Okay, my microphone is live. It's as live as a gaboon viper. Okay, next is a panel on birth and psychedelics. And on the panel, Dr. April Boulding, whom you've met, Angela Ward, whom you've met, and Meg Heatherford, whom you have not met. Meg Ford has been working in the realm of women's health for the past 19 years. She is a full-spectrum birth doula, acupuncturist, mother, and psychonaut. She is also the creator of 13 Moons Lunar Diary. It is an illustrated yearly planner, inviting a unique way to engage our experience of time as circular, seasonal, and lunar. So let's welcome our panel. Thank you very much.
All right, thank you for welcoming us back. And this is Meg Heatherford, who's joining us now. We're all birth wisdom keepers in our own way. Many years collectively of experience between all of us. And we're really wanting to bring the divine feminine and change it up a little bit. It's really been heady, very, very mental body in here, a lot of information. How about how great Meryl did? Wasn't that fantastic? Fantastic. 5-MeO-DMT. Wow. Yeah. Toad. Toxins, not venoms. We take toxins and venoms. Anyway, so we're shifting it up a little bit. We just want to bring that feminine part of things in here. So Angela's doing some smudging. They're both doing some smudging. We're just putting up a little bit of an altar here and bringing in community, because part of the movement of these days, of this time, is bringing forward the divine feminine aspect up to balance the divine masculine. And we're talking about the unity field within the 5-MeO-DMT talk, right? We need to have the feminine rise up to meet that masculine that's been an imbalance for so long. So we're glad to be a part of that. And I invite you to just, let's come into coherence with each other. Not a whole lot that you have to do. Let's all take a collective deep breath in through the nose and out through the mouth. And just feel where you're sitting for a second. And let's do that again. In through the nose and out through the mouth. I want you to bring your attention to your heart. You might want to put your hand on your heart. I'm going to take you through just a little bit of centering within yourself, and then we're going to come into coherence with each other. So placing your hand on your heart can really bring your attention there. So breathe right into your heart center. Inhale. And exhale. You might even close your eyes for a moment so your inner eye opens, that you bring your awareness to that heart center and then see a light radiating in all directions there. Keep breathing in and out, feeding that light. And let that be radiant. Now, some people know how to do this more instantly than others. It might be new to you to do this sort of thing. It's okay. Be where you are. Shine your heart light. I want you to shine a beam of that light to your lower belly. You can place your other hand on your lower belly too, if you'd like. And then just beam that light from your heart down to your lower belly. If you have a uterus, we sometimes call that the little heart. And sometimes this can beat in synchrony with your heartbeat as well. But we're really seeing this lower belly as a seat of the feminine, however you identify. We all have feminine within ourselves. Let that glow with light as well. Deep breath in, deep breath out. coming into your body, not so worried about what's going on around you. Cultivate that light and that coherence within yourself. And just let that be right there in your lower belly, mind's eye up to your heart. And what I want you to imagine is send out a beam of light from your heart to everybody else's heart in the room. Breathe in, and as you exhale, see a beam of light from your heart connecting to each other's hearts, creating a grid pattern within this room. Really watch with your inner eye. The I, imagination, I, magi, you are magic. Now see your lower belly light connect to everybody else's too. And really notice this crystalline grid that we are creating here with this breath, with the intention, calling in coherence, being little nodes of intersection of love, and knowing that it's not just you sending it out, it's you receiving so much in this moment from somebody else too. That we really are a collective. We feel alone a lot. But that divine feminine way is that there's room in the circle for everyone. We're receptive. There's unconditional love here. There's compassion. So feel all of that. Run the resonance and the frequency of the feminine. Almost like there's an inner smile of a mother who has unconditional love for her children, just smiling down like, oh, I just love you so much. Have that for yourself right now and just send that out to each other. And aren't we so grateful for each other being here? Thank you for showing up, for being here. Thanking each other that we're not alone. We are not hopeless. We are not powerless. We have come together in this place as a community to start to learn what seeds we want to plant for the future, for our collective. So, now maintain that grid of light. And if you have your eyes closed, just gently open them. But your inner eye is still noticing how we're connected here. Starts to be an advanced skill when we start paying attention to this third dimensional world, this consensus reality. But also this is going on. If we're in resonance and coherence, it makes a difference. And our intention and our ability to do this creates a whole new feeling in the room. So, we're going to talk about what seeds we'd love to plant, what vision we'd like to see come forward within the realm of psychedelics and birth. And one thing that we want to say, you probably have, we've all been born here, so you might have some opinions about birth and maybe some of those things that I've said prior and that we might be saying here. And we're going to open it up for discussion as well so that you can have your voice heard. So take care of yourself. Not one thing fits all. So let's stay in this coherence. I would love for Meg Heather to start us out.
Thank you, April. Thank you for bringing us back into our bodies. Can you guys hear me okay? Louder. Okay. I want to continue where April left off because she brought us from our heads right back into our bodies. And we live in a world where it's so easy to just live in our head all the time. We're so stimulated all the time by these external screens, usually. And now that April's brought us into our body, and we've talked about the subject matter in general, it's very easy to presume that it's really just women's health information. And I really want to challenge that. I want to challenge that by having anyone who themselves either has ever or currently has a womb in their body to raise your hand. Now, anyone who has themselves emerged from a womb, please raise your hand. And what I really like about the womb is that it just transcends gender. It has an enormous impact on each and every one of us. And one of the things we talk about is the womb really as a portal to psychedelic medicine for women. Now, not everyone who goes through a birth is going to have a psychedelic experience. April beautifully described one such experience. Having witnessed hundreds and thousands of births on the stage, not all births are transcendent. Let's go back to that vision of a womb and how it connects us all. Now, in psychedelic medicine, there's a lot of talk about mushrooms and the mycelial network that is the language that connects mushrooms, and it is how trees talk, without which none of us would be here. I want to present another visual for you all, and that is of the wombs. Think of your womb, think of the womb of your mother. Imagine the matrilineage of all the wombs in your family. Think of all the beings that emerged from those wombs. And now expand that across the globe. Do we not have a web of wombs? And can we not tap into that deep, ancient wisdom that has always been there? We are not discovering this. One of the more beautiful aspects of psychedelic medicine for me personally is this idea of remembering our future. So many of these medicines have been around for thousands of years. And the danger we've all talked about is now you've got white people coming in and pointing it out. We are all cisgendered white women. So many people in the birth community that have laid the ground for all the work we do were not white. They were indigenous keepers of wisdom. So much of that wisdom has been lost. Much of it by the unnatural containment of the medical model, which again is a theme throughout the day. So hold on to that vision of the womb as a connective force. Could it perhaps not be the energetic opposite of the internet? Perhaps it's our way into remembering each other and our connection. Certainly one of the themes that we want to talk about is the power of what Angela so beautifully brought up, which is what is the psychedelic model of medicine? What are the models we want to create so that we can remember this wisdom? We all have it. It's free. This is not about affording it. It's about remembering it. And I will just say, personally for me, before I pass this off to my sister Angela, that for me, I think I've had maybe 5 what I would call peak transformational experiences in my life, each one opening the door to the next. And about 3 hours into the first, which was the birth of my eldest son, everything I knew to be true about me and my world and my place in it was absolutely not. My whole sense of what was supposed to be 100% failed me, and it was a deep crisis. It was the psycho-emotional equivalent of 40 days and 40 nights in the desert. It broke me. And even though it really only lasted 1 hour, it took me probably 1.5 years to kind of reintegrate after the most powerful, most profound, most experience. And had I not been blown open by that birth experience, I would not have sought the medicine that brought me into a shamanic journey, that brought me the medicine that led to a phenomenal, transcendent 2-hour delivery of my second son. And from that moment on, I have been walking the path of birth work, and I never made an intellectual decision to do that. And that's my final point here right now, which is that none of this is intellectual work. This is womb work, this is spirit work, this is heart work. And we are all a little bit uncomfortable in those realms. And I believe one of the purposes of psychedelic medicine is to help us to get comfortable in those realms and connect.
Yes. Thank you both. I'm really honored to be here with these two lovelies and to be with you again up here. What we're really talking about are portals of transformation, and April talked about this in her presentation so profoundly. And I would also make sure that I want to include death as part of this portal of transformation. Birth, psychedelic journeys, expanded states of awareness, and death are opportunities for us to deeply re-examine what it means to be human. And I'd like to talk a little bit, I'm absolutely in gratitude for my male teachers and leaders that have brought some ideas to the forefront. And I'd like to talk just briefly about Stan Groff's perinatal birth matrices. I've had the great privilege of studying with Stan Groff, and I've talked with him in his older years, and he said that once he created the birth matrices, they kind of were out of the gate and on their own. And we use a lot of that concept, I think, in our approach to psychedelic medicine. But I think what it actually illustrates is that in his paradigm, the person that is reliving their birth experience is pretty much going through a traumatic experience that is profoundly isolating and can be quite combative and very much a hero's journey. I would like to contend that at the time that Stan Groff was born, our birth practices had been changing dramatically from our ancestral wisdom. It's likely that he and a number of the people he finally worked with when he was doing LSD psychotherapy were people that had been born to mothers that were giving birth in twilight sleep. These women were anesthetized. They may have likely been given some kind of induction agent. Frequently, they were strapped very violently down in beds and were not able to move their arms and their legs, and they had no memory of birthing their babies. Babies in this era were often born with forceps deliveries, very forcefully birthed at the convenience, at the time of the clock that says it's time to have the baby out, and then they were separated. This is some of the initial wound, the attachment, that we're talking more about attachment theory nowadays. So baby's born, and I'm taken from my mother and put somewhere completely different where I'm injected with medicine. If I was a boy, likely circumcised, likely without anesthesia, forcibly fed with perhaps formula that's not actually the medicine from mother. I would like to re-envision what birth and psychedelics truly can be about. You saw from those beautiful pictures that April shared that the way to do it is mother brings baby forward in a fully embodied way. She is aware, she's present, she's feeling this dance she's doing with her baby. And baby comes right here. And baby hears her heart and her voice and her breath. There's no break in that connection. There have been some fascinating studies done with fetal consciousness and the way that we wire pathways in our brain. It's important immediately after birth that babies are here, so not only can baby wire their brain socially, but mothers, birthing people can as well. There's also evidence that shows that fathers that hold their baby after birth for about 30 minutes wire a dopamine pathway in their brains. The reward center. You do a line of coke or you win big at Vegas, or you hold your baby and you have these like amazing connections. We talked earlier about diseases of despair and the disconnection that we feel, and I would argue that part of that disconnection is deeply rooted in how we are born into this world. I have some questions for you guys, I think. What should we ask first? What wants to be asked? How might we build in this nurturing connection, these transformational birth experiences in the psychedelic model?
You know, I would say is that we don't know everything. I think having a beginner's mind about some of these experiences is really important. Going in as the expert, like I'm the one who knows, I think that's overrated. I feel like that's the old way. I think going in to more of like the midwifery model of care, certainly out of hospital birth midwifery model of care, it's very supportive of what the parent, the family unit wants at that time. And I think that's the same, that can be the same with psychedelics too, is that we really want to tailor these experiences to this person and have trained expertise to, again, not meddle, not guide. We know that people in birth states and in psychedelic states are highly imprintable, right? Angela, doing the work that she's done in the ketamine clinic, I mean, she really notices that and takes such good care to only pick the highest vibration or the cleanest or interact in the highest way.
I only played music that was like absolutely what Fred said earlier about it really opened it up and brought it into more of a sacred realm rather than like death metal.
Or like you said, like the evidence-based research accepted playlist didn't work for him. And he said, I'm going to go through it. I'm going to make myself try that music. And he wouldn't do it, right? He said, I couldn't do it. So being able to move in the moment and not think we know how this thing's going to go, walking into the mystery together, we don't know how it's going to go. I think us as we're birth doulas. You used to be a birth doula. Now she's a labor and delivery nurse. So it's like we don't know. I think that's a vulnerable place to not know. I love it.
And I will just piggyback on that with this idea of knowing. And again, my question is, where does our knowing come from? Does it come from the books we read and what our teachers taught us and what we saw our parents do? Or does it come from something deeper? And again, I'm referring you back to this kind of intuitive intelligence of the womb. Perhaps that is what informed your selection of music. But again, back to the model, like how can we take what we know to be regenerative and connective in birth and apply that to the psychedelic community? And I can certainly refer to a beautiful medicine ceremony that I was at with these ladies here. And so much of what allowed the transformation to occur in that space was related to the container that was set. So again, there's not one expert reading the books and saying, okay, first we're going to do this and then we're going to do that. It is this organic collective of setting a stage, and it involves the space you're in. It involves the intentions that are set. It involves the guides, the people who are there as guides and holders of that space in the name of safety and consent. So a container can't be held by one person, so we have to move away from this individualistic model that can be replicated and move into this organic, intuitive collective. And when that space is safely held, a lot of unfolding can happen. And not only that, but the unfolding that happens is not just my individual story, but I am making myself vulnerable in front of a number of other people. And this, to me, really opens the door. This was honestly my first experiential kind of opening into what community medicine is. What does community medicine look like? And what impact does that have? Relationships got made in that circle and the ripple effect of that. So it wasn't, I'm not well, I'm going to go and get some help. That is not a bad thing. We should all get help. What does it look like to not have to hold all of that as an individual? I'm not solely responsible for healing myself. Perhaps we can all help.
I'd like to speak just a little to that because I am someone that has worked in birth in a hospital setting. And I do acknowledge that there are ways to learn, and there is information in books that are fantastic, but it has to be more comprehensive than just reading the book or just having one teacher that does it one way. I think it's very important to kind of start discovering one's own sense of intuition. That's something that we don't talk a lot about openly in the world, but absolutely it's part of how nurses work. Like someone would come into the hospital in a birth center and we'd be like, she's gonna blow that baby out in about an hour. You know, you just would get this embodied sense that something was up. So I think that there is a lot of resources, but there's something about reclaiming our own intuition and trusting it while also being connected to others, because I would never be in a birth situation by myself. Like if there was something concerning, I would call in the others so we could look at it together in service for the people we were taking care of. But one thing I did want to speak about that you talked a little bit is about the set. And it is so challenging in a hospital environment, especially around birth, to maintain this sacred container where the birthing person is truly our focus. April spoke beautifully to how we have this litigation culture. And I'm deeply concerned that we might move psychedelic medicine into this similar kind of model where we're like, oh gee, they're starting to go down this path and that's pathologized and let's get the benzos out, or something like that. And of course there's a time and a place for medical intervention, but if you are a hammer, everything's a nail, right? So how can we build in these sacred container spaces, even if it needs to be, some people are going to need a more medicalized approach. They're just going to. Some people are going to be able to do this in a very open community ritual setting. What are your thoughts about that?
Well, I want to speak a little bit to that intuition and just reinforce that. I think these psychedelic awakenings can awaken our psychic abilities, our intuitive abilities, our finer senses. And when we start becoming empowered to that, I think we can, like birthing women can bring that to the institution and to the out-of-hospital birth model as well, that she knows for herself, like, that isn't a good decision. Like, so what I'm saying is, like, these transformations that people go through even before they get into the birth room, starting awakening the intuitive senses, helps them know, be more attuned to the subtle realms and the realms that work within them that maybe somebody on the outside would never know would work or not work. I don't think I explained that completely clearly, but anyway, you want to talk to?
Well, I was just
her
thinking
point?
more about like how do we bring something that's sacred into an institutionalized setting? I mean,
Especially an institution that we could probably all agree is pretty unhealthy at this point, right?
Absolutely. And one of the fascinating aspects of my role as a doula is I really live outside of the institution of medicine. One of the things that I've come to see as my power in that role is the fact that I often will attend a hospital birth as kind of a representative of what can be and what can be normal and try and protect that space to the extent that it's an option. But I do not work for the hospital. I do not represent the hospital. And for me, that's an extremely important boundary that I won't transcend. I am there on behalf of the birth giver. Now, I believe the institution should exist on behalf of the birth giver, but what we know is that the institution exists on behalf of themselves and protecting themselves. And so it's a balance. On the one hand, I counsel my clients first and foremost to make a considered decision about where they would like to have their baby. I was fortunate enough to have my babies in the UK, where it was essentially free, and I didn't have to pay a cent. And I got to have 2 home births, and nobody sent me a bill. Unbelievable. I was 12 weeks pregnant, and I was like, I'm having a home birth, and I was so ready to put up my dukes and fight the system. And the very first question I was asked by this young student midwife was, where would you like to have your baby? And I was like, what? And I kind of sheepishly said, I would like to have my baby at home. And then the kind of oldest midwife in the room, swung around, her eyes lit up, and she was like, fantastic. We love home births. And now my husband was sitting next to me, and he's thinking, what is my wife thinking? Home birth is still not normalized. You put up the statistics. It's like, what, 2%? 1%?
1%.
And my husband was entitled to his fear, and he was entitled to his worry and his anxiety. But by watching that institutional response from the midwife, for whom this was her job, completely normalized and validated my choice, and began his journey in doing his work, handling his fear, so that he could actually support me. And this brings up another realm. Birth is not just women's work.
Yeah.
And one of the harms of institutionalized medicine is that we have taken one of the most powerful, one of the most incredible displays of human power, a woman in labor, and we have hidden it inside these little hospital cubicles.
And we've taught her to fear what she's going to be going through, that it's fraught with danger, that the pain will be unbearable, and you're not going to be able to deal with it. And then she's shamed if she chooses an epidural or a golden parachute of some kind, which is not in service at all. People say, well, you're going to have a healthy baby at the end of this. And I'm seeing some of the same thing in our ketamine experiences, you know. Ketamine works anyway. The evidence shows that it is going to help with depression. But if we can soften that, what is the transformation? What is the benefit maximization of these experiences? What if we stopped pathologizing them? And what if we scaffolded them to allow people to find their own deepest inner healing wisdom? How might it change how we are as parents?
By far, my favorite point in almost every birth is the moment where the birth giver is at their peak of, holy fuck, this is insane. I mean, it happens every time. I don't care if you get an epidural or not.
Everybody.
Exactly. It is a universal moment.
Yeah.
And birth workers are like, yeah, this is all happening just like it should.
She's gonna start pushing soon.
But that is not what you're feeling when it's happening to you. But what I love about this moment is the partners, they are looking at their women in utter astonishment and awe. They cannot believe what they are doing. And every single one of them knows without a doubt that they could not do this. And this, to me, somebody was talking about the harm that's done when you take something like a community psychedelic experience and you take it out of the context of community. Prior to the establishment of the American Medical Association in early 20th century, birth was a community event. We had access. We could have abortions. We could have babies. There were midwives and herbalists and naturopaths, and it was community medicine. We have done this before. We have forgotten that we know what this looks like. And other people have to do their work. Birth is a powerful, powerful experience, especially when it is held in the context of community and connection.
Yes. You know, I'll share a story from a couple. My childbirth education classes, I teach a series, and then we have birth reunions where people will come and share their birth experiences. And there was a couple where the husband is this really big dude. He's like 6'3", 6'4", just big guy, and he's from Czechoslovakia. And when it got to their turn to talk about their birth, he could hardly communicate. He's like, I do not know how she is as powerful. In my country, they don't let men anywhere near the birth room. And he says, I'm watching her and I think, oh my gosh, how can she take any more of this? And then she did, you know, and his wife is just, she's badass, but see, I mean, she is. And then seeing his reaction to it, he's like, I got on the phone right after that to my dad, and I have 2 brothers back in Czechoslovakia, and I told them, women are so powerful. They're not letting you know that in that country. This is not right. You've got to know. And so, you know, that is astounding to him. It really, I think if women are able to see that kind of power within themselves, it's transformative. When we're able to witness that, it's transformative. When the partners, I mean, and that's what we see all the time. The partner's like, oh my gosh, it keeps going. We're getting in the tub again. Okay, you know? And it's just, and they weren't allowed to go into the birth room for a time. They just like, nope, partner's out, father's out, and they're smoking cigarettes and pacing, right? I think that's what the whole thing is in the waiting room. And then the way they got back into the birth room was this Lamaze, this idea of Lamaze training, and like, nope, my husband's my birth coach, he gets in. You know, but we've learned from that model is that he really can't be the coach of a game he'll never play. And he's, right? You know, and he's pretty glad after he's been at one game that he doesn't have to play that game the way she does.
He's psyched.
And, well, yeah, what I'll say is, and it's not fair to him either to have all that responsibility. He's going through a lot too, his own transformation, seeing his loved one reaching their ends and shaking, and I can't do it. And he's like, somebody give her relief. So you need somebody else in the room holding that big, big emotional, someone who can hold that container that does not have to be him or whatever, you know, or her.
That totally brings it back to what you were saying about, you know, belief. We have to believe and trust people in these processes. I can say so many people I've been with in birth and with the ketamine experiences is that when they hit a wall or they got to the end of their rope, I could still believe, because I've seen it more than once, that you will find your way. I can hold that belief for you.
Yep.
And I think it's really important. I want to acknowledge that there are a number of healthcare professionals that are drawn to psychedelic medicine because they have hearts of gold. And there are a few people in this room that I could speak to that I really trust their motivation, and I'm really hopeful that they will be change agents within the system to help blossom a new way of being in these spaces together. But we have to believe that it's possible.
Yeah.
I also think it's important for providers to recognize their capacity. If you're unable to experience these medicine spaces, and believe me, people, it's not an excuse anymore. If you want to do this work, you can find a way to have a well-guided, cared-for experience, either in this country illegally or outside of the country in a legal context. It's time to make sure that you have that experience so you can relate to it. But let's bring it back to trusting in the people we're caring for and believing in them.
Absolutely. I want to touch base a little bit on this idea where I think birth and psychedelics converge, which is the idea of them as what I call experiential medicines. So it's not the plant, just like it's not just the womb. It's the whole picture. One of the reasons that the studies have shown that the presence of a doula in a birth room is impactful is that we are there to support the process no matter how it unfolds, unconditionally. It's very easy to kind of eulogize, you know, transcendent, glorious birth. I've had kind of one of each. Birth can suck.
So can psychedelic experiences.
And this is
What?
And this is really my point. And
Right.
And one of the conversations I love and enjoy having prenatally with my clients is kind of challenging this idea of this dualism of like, oh, I want to have a good birth, like, oh, I want to have a good trip. And I just don't think the notions of good and bad have a place in the birth room. Because we're talking about the emergence of a being into this world. How is that not fundamentally good? It can be extremely challenging. It can bring you to your knees. It can show you what you are capable of, and it can traumatize you. What matters is not the sequence of events, whether you had an epidural or not, whether you stayed home or whether you moved into a hospital. What matters is how you feel about what happened. And this, I think, is very resonant with psychedelic medicine. You can have an extremely difficult journey where you are meeting some dark shadows and looking at or remembering some difficult things. And that can be medicinal still if you are held, if you are protected in an environment, in a container like we spoke before.
And not only just in that initial container, but also given space and support to make meaning from that process.
Exactly.
So that you can have the dark night of the soul, be it birth, be it psychedelics, maybe it's profound grief of someone you know that died. But we have to make meaning of it. And it's very difficult to make meaning of these experiences in a vacuum. We need to be able to reflect this off one another and kind of try out what it might mean and how it might change my life in those ways.
We need to be able to have a hard time. It has to be okay to have a difficult time. We need to move away from this kind of kind of intensity of, oh, if it wasn't good, I don't want to hear about it. Mm-hmm. There were a lot of people who did not want to hear about my birth. It made them so uncomfortable because A, it didn't reflect theirs, and B, it was connected clearly to a much deeper process that honestly has led me to right here. Mm-hmm. It was important for me to have a difficult birth. It was my medicine. And I think one of the dangers, certainly, of how birth used to be, and in some ways continues to be, is we are taking away from women the access to their medicine. And it doesn't have to feel comfortable all the time.
And that's the initiation, right?
Exactly.
That is exactly what is designed into our lifespan, is an initiatory process for the birthing woman. And it's all kinds of things. I would say, like, at the peak of pain with one of my childbirths, the home birth, where it's like at transition, the peak of pain's happening, and it's so painful. I just saw like this portal, this white opening portal open up in my third eye, and when that pain went away, the portal went away. So the next contraction came again. Oh, it's so intense, but here I'm seeing the highest. So it like this extreme, like I wouldn't have been able to see that this sacred portal illumine in my third eye if I didn't have that extreme sensation driving that. And I want to speak to men maybe not having initiations in our culture. So where are the men's initiatory experiences? And I think psychedelics are very useful for that. They can help with this so that they can be challenged in ways so that they can find their resourcefulness, their resilience, their edges, that I can't do that, and then go past it and start tempering that default mode network, which has been falsified as being, we're bigger, we're better, we're good. We need to break that down, dilate that ego a bit. I mean, what? In a good way, in like the most loving way, I mean it. I mean it in the most loving way. And not everyone can do a sun dance, and I'm so glad that you're participating in that. And that is a big process where the men come together in heart. So thank you, Gentle Eagle, for making that up in the beginning. So initiatory process for men. We want you to have your rites of passage too, in whatever way you feel comfortable doing that. Yeah, I want to say that. Mm-hmm.
Are there any questions at this point? We
Yes.
have brought up a lot, and we do want to hear from you if anyone has some questions they'd like to ask. I can hardly
You
see.
in the front over here.
Okay.
Okay, a lot of pressure now. I just want to make a quick comment about appreciating the opening, that it doesn't have to be good vibes only, that actually diminishes our experience if we put out to other people that the only countable experiences are those that meet expectation. Thank you.
I have a comment that may not be entirely appropriate, but I want to talk about, as a male, my initiatory experience, which was, I would date it July 13th, 1973, when I was in the birthing room of Angie, And what I remember about her is that her eyes were so wide, she was taking in the light. She was just, it was like she was absorbing everything. And I was thinking to myself, I'm not ready. I'm just a kid. I'm not ready to be a dad yet. But I'm really proud of you at this moment. Thanks.
Thanks, Dad.
Oh, my goodness.
That's so beautiful.
Well, you know, I mean, thank you. But that also, I want to speak a little bit about fetal consciousness. You know, we were all that wide-eyed infant at one point. And please understand that we didn't suddenly come out of the womb or the uterine bypass and the light switched on, right? The light wasn't suddenly on when we were born. Much like how people die, like babies kind of filter in and become more present. And that's one of the coolest things about psychedelics, I think, is having these conversations about consciousness. And what does that really mean? Who are we? If anyone in this room has had the privilege of being with someone as they've died, you may have noticed that who they are may still be in their body after they're not breathing, but then they kind of diffuse out. Babies come in the same way. So what does that mean for us? And a lot of us have had the opportunities to explore that in deep psychedelic space, of who might we be outside of this lovely flesh bag we get to hang out in for however long we get to hang out in it.
If anybody has the answer to that, we'd like to hear it.
Yes, please.
Meryl?
Step forward.
I'm just curious if you have any doula training programs that you could recommend that focus on these kinds of philosophies.
Wapio.
Yeah, Wapio. Is it?
Wapio, Diane Bartlett, right?
Yeah,
And I
Diane
will-
Bartlett.
And I will also say, in general, I would highly recommend considering a full spectrum doula training because, again,
Yeah.
while it's very easy to just talk about birth, reproductive experiences include miscarriage, abortion, losing your uterus, having a hysterectomy, having babies, and having those babies not live. These are all extremely potent and powerful experiences. Choosing to not have a baby, whether that's through abortion or just choosing not to get pregnant, is an extremely potent and powerful experience. And we are moving now into an age where we are claiming our sovereignty over what enters and exits our wombs. So
Our whole bodies.
whole bodies. So to train as a doula, I think it's really important to hold that wide umbrella of what does it look like to support the full range of reproductive experiences. I don't think I fully became a doula until I supported a client through their stillbirth. It was the same work on the other side of the portal. And the importance of having someone be there and witness her as she stepped into this grueling, extremely heartbreaking pain was essential for her. So that would be my advice. There are many, many doula trainings. There's a huge conversation within that world of the standard of care and do you have to be certified or not unlike psychedelic medicine.
I would say Indie Birth, too, has just come out with a new Indie
Oh, Indie Birth.
like independent birth. I think they're out of Arizona, Sedona.
And I think also for anyone that's interested in working with people in psychedelic states, working with people in birth is a beautiful way to learn how to do that because you really do learn how to be in that dance together instead of pathologizing what's happening. You can really surrender into trust. It's very beautiful.
I want to thank each of you for so solidly holding feminine space in this conference. And also, we're talking about, mics are weird. We're talking about kind of midwifing psychedelics into the world as a form of medicine and not
Yes.
letting what happened happen to birth. And if I see the goal, but I wonder if you have thoughts about ways to foster that, ways to midwife that.
That's why we're here.
We have lots of ideas.
I know. So exciting. Like some of these, I think that's where these visionary conferences come involved. You know, there are different people that are coming as care providers that are trying to figure out what way to navigate this, and we're giving our ideas. That they're videotaping, hopefully, and hopefully this ripples out. So that's what we're trying to do is share the information that we think.
And like people have said before, it's really up to all of us. And what initially drew me to studying Chinese medicine was that it was really based on a model of what health looks like, as opposed to our Western medicine tradition, which is kind of like deconstructed and focused on pathology. We are extremely good at naming it, isolating it, and treating it. But we do not do very well at holding up as a model, what does a healthy person and community look like? And I think it's that widening of health as an individual pursuit towards this collective experience. I am responsible for you. I am invested in your health. Your well-being impacts my well-being. And I want to do work in that realm. And I think psychedelics maybe has something to show us. What does that look like?
Totally. And I think one concern that this keeps bringing up is, of course, do psychedelics fit in the current model of society that we're living in?
I don't fit in it.
I don't either.
What?
I mean,
it's like having a baby. It's like we're rebirthing this different model into a non-ideal situation, right?
We have to start visualizing what the matriarchal model of health looks like.
or I
And
would
then
say
how
the
do we get
balanced
there?
whole. Well, the balanced whole, because there's, all are welcome here.
Yes.
And yet, the capitalist, corporate, greedy model right now that we can't help but be immersed in, I don't know that we're going to be able to necessarily come up with the solution independently. And it's not just up to you, one person, to say, this is what I want, or I want my birth to be this way. We have to start talking about it together and really dreaming what it could be like. And what does health look like? I would argue it's really hard for us to even see what health looks like right now in the society that we live in.
Can y'all hear me? Oh, yeah. So I have a comment, question, encouragement, and I hear a lot of women wanting to do doulaship and study being a doula. And I would say, go for the big, be a midwife, take the responsibility, grab that uterus by the horns, and, that's being there's problems with being an authority, but being the authority and the one who, we have to have midwives to have home births. So
I agree. What do you think about lay midwives not going through the system to learn how to birth?
You want to help with birth and midwifing the new way, be a midwife.
Thank you so much for that. The
I have a
midwifery
lot to
model of
say
care
on that
is so
topic,
great.
but we can talk personally.
Hi, I am a reformed clinical practitioner. My background is TMS, transcranial magnetic stimulation for treatment-resistant depression. I'm currently now a spiritual practitioner, and for the last 5 years, I've been doing high-dosage psilocybin trips. But I'm also 36 and pregnant with my first child. So I'm really excited about her birth, but I've been a little bummed out because it's been 4.5 months without my medicine. So I just find it so enlightening how you guys were able to bring those two together, because I didn't really connect the dots of this being comparative to a psychedelic experience. So I'm super excited to bust this out.
Oh, yeah.
Right on, sister. And that is so great. Congratulations. Can we give her a hand? Yeah, she's going to give birth.
Welcome, little
nice
one.
job. One thing that we know is that when you're coming up into a big, like you commit to an ayahuasca circle, and it's like a couple months out, right? The drum beat starts when you commit, right? Or you have a big ceremonial event. So that's kind of the way it is in pregnancy as well, like that gestation, something's going on. You're in that preparation mode. You're in like, I don't want to do this. Why do I have to do this? Should I cancel? Do I back out? We can't back out of that usually. At one point, we can't back out of that. And then, so it's important, like this moment, without your normal channels with psilocybin, to develop this other way of relating to this and feel all of that you're feeling, whether it be fear, excitement, or not knowing how it's all going to be, and set up your peak experience, like the birth experience, with as much support and love as you can, with integrating all of this, and definitely set up the postpartum for sure.
Yeah, lots of support. I would also say,
Integration.
be curious about noticing how she's arriving. Like, I know you know this baby without her being like out of your body.
Oh, yeah.
And that is like, in a way, you can imagine this pregnancy, birth, and then transitioning as a really kind of spread out psychedelic trip, right? If you condense this whole thing, it's pretty wild, but you're still, like, the medicine's coming on, sister. So it's going to happen, and just enjoy as much as you can. Be curious.
You ladies are just angels. I had my daughter in August of 2018 and experienced my first Pacific North winter as well. And I'm just curious, along with psychedelics, what would you recommend for postpartum depression or anybody that's experiencing any postpartum anything? What type of community or therapist or, hugs.
Stay in bed, hang out with your baby.
Yeah.
But in community, absolutely, you do not have to feel all of this and go through all of this alone. Who are your people? Who are your community? Let everyone hold it with you.
There's also a beautiful practice that I wish we could incorporate into psychedelic medicine some way. That's a traditional Mexican midwife model with a rebozo that's called the closing of the bones. And after a mother gives birth, they wrap the rebozo around to like reintegrate her body physically. It's just an energetic practice, and it's so beautiful. It makes me feel a little teary just talking about how sweet it is, because with birth, you're opened wider than you've ever been in your life. And a psychedelic can certainly blast you out like that, but there's something about bringing that back in and being held by the people around you.
And then reaching out to those institutions that really have been formed by women who have been through this. I know in Seattle, we definitely have a women's institution. Was it PSI, Postpartum Support International,
Yeah.
and getting a network, getting hooked into the network, because people who have been through that really don't want women to go through that ever again.
So maybe you
there
can
are a
reach
lot
out
of
to
women,
this lovely lady for her journey and pull her forward.
So reaching out and not being ashamed to sometimes get on some medication to help stabilize you that is absolutely medically indicated at certain times, and you can do that without disrupting breastfeeding too. There should be no shame in that. Yeah, and eating placentas. Yeah. Like
Seriously.
encapsulating placentas. I mean, why are women eating their placentas these days? Why is that trending? Not because they want creative smoothies, but because they don't want to feel that in the postpartum. So, and I feel like I've only heard of anecdotal evidence of that being helpful. Is there a study? Okay, there's one study.
I made my husband encapsulate my placenta. He did it.
We're at time.
Okay, I have a statement or something
Yes,
I wrote
ma'am.
I want to just read to close
And
us
then
out.
we'll close.
If that's
Yes.
okay. I'm not going to quote a man. I'm going to quote me. If
Without
that's okay,
apology.
ladies.
Look at that.
That's right.
What's that mean?
Okay.
What's that look like?
Here's my last final sentences. Birth and plant medicines are sacred offerings, revealing to us our capacity to create life and remember ourselves into this world. One opens us from within, deep, sacral, primal, inevitable, fierce. The other opens us to all that is, the cosmic web of consciousness, showing us the unending dance that is love, loss, birth, and death.
I'm good with that. Thank you. Thank you all.